I'm Rachel Kucher, and I'm a state certified music therapist in the state of Utah, and also a board certified music therapist. And I primarily work in the school setting with the deafblind population, autism, the whole works. I also have my music education degree and my teaching license, but I'm in the schools right now as a music therapist. So I'm working on non-musical goals such as cognitive goals, emotional, social, things like that in the school system. I'm not really working on teaching music concepts, and there is a very definite separation between a music therapist and what a music educator does. In the deaf and blind population, I'm working on them allowing the outside world to come into their world and them to interact with the world outside of themselves. And as a music educator, I would not be working on any of that at all. I would just be trying to teach them how to play instruments, how to read music, how to play music, all that stuff. So it's very different, and the purpose is completely different and separate. They're completely separate entities, music therapy and music education. Typical interventions that I use in the school setting include movement, instrument play. At the end of the session, I do relaxation with either scarves or a book, depending on their age and how the session is kind of going. We also work on, I have a personal space song, which is pretty fun. So we practice giving each other personal space, and we work on turn taking, things like that, choice making as well, all during the group session, so that these kids can practice these skills so that they can take it back into the classroom or wherever it may be and actually be able to utilize them. I also do some drumming for self-regulation with some of these kids, especially preschoolers, because it's hard for them to process verbally what's going on or explain how they feel. So one of the girls I see individually, if she is becoming dysregulated, she also has autism, so if she is dysregulated, then I'll encourage her to come into the music office, and I will hand her a drum, and she will just bang on that thing until she is done, and then she's just like, I'm done. And then she'll just go back out and work, and she's good for a while until she needs it again. I think the most important thing for people to understand about a music therapist's role in schools is that we're there to help the students grow and be successful in school. So maybe they are not understanding math concepts, or they're struggling with speech or something like that. So then the music therapist can come in there and help the teacher and the student figure out ways so that they can grow in that way, because it's not working. It may not be working the conventional way. You want to think of it like that. So the music therapist can think of songs to put these math concepts to, and then it's easier for the child to remember those concepts and utilize it when they need to use those skills. The most important thing people should try to remember is that the music therapist is there to try to support the student in that growth, as well as the teachers and the staff there, give them tools that they can use in the classroom. So.